Hey, I'm Dr. Dooley. I'm a board certified psychiatrist. So if you follow me for a while, you've probably heard me talk about my transition from direct patient care to a non-clinical career. And I've talked about, you can look back at my prior videos, but I've talked about some of my personal motivations, professional motivations for doing that. I completed a master's degree in public health about a year ago, and my concentration was management and policy. So I've been able to learn a lot and get a better understanding of the healthcare system as a whole. So we in direct patient care, right, patient to patient, and that's definitely a way to make an impact. Public health, right, looking at big systems, looking at the population and making an impact that way. One of the reasons that I come here and I have talked about the insurance industry, peer-to-peer calls, how things work, medical necessity criteria, is because in my personal experience as a medical student and resident, I didn't get very much about that at all. I didn't really have any understanding of how your work generates money, income, how the hospitals get paid. I was trained in is how to be a competent physician, caring, compassionate, evidence-based. That was really the things that were focused on. Or there even I spent a lot of my time in the VA, not even understanding that, in America, that's probably the closest thing you'll get to a socialized medicine, right? When you work for the VA, you are employed by the government. The government is funding the facilities, right? And making the decisions about things that are happening healthcare wise, specifically in that system. Understanding the budgetary process in the VA and how that impacts the work I'm doing, how many people we hire, why things are understaffed. I just got very little exposure to that. And I want to be helpful, if I can, for physicians who are still practicing and have to engage with the American healthcare system by providing this information. What is these peer calls based on? What is the goal? Because honestly, when you are a caring, compassionate, competent healthcare provider, you just would not think that it would be necessary to have conversations about certain things, about certain medicines you're prescribing, about hospital lengths of stay, because you are those things. But being on this side of it, I'm not gonna lie, even when I was in direct patient care, I've worked with some people who were questionable. But primarily working now on the insurance side, some of the things I've seen, they will leave you speechless, particularly amongst the care of people who are in mental health, because they often do not have advocates. They often don't have support people checking on them. So they go in these hospitals, and to see some of the care they get, and then some of the care they don't get, some of the things that people are kind of willing to dismiss, because it's just eye-opening. I can't even find the words. I was literally speechless about some of the things and cases that I reviewed. Understanding how much fraud, waste, and abuse is in the healthcare system. Again, when you're caring, compassionate, competent, you probably don't even consider that people would order tests and durable medical equipment, or keep people in the hospital longer than they needed to stay, because that's not something that you would do. But I'm here to tell you that it's much more that than I ever even imagined that it would be, now that I'm on this side of things. And the other thing I've learned, particularly from my public health training, is that decisions are going to be made about policies and procedures that you're practicing with. Somebody's going to make decisions about that. And if you're not at the table, if you're not giving that clinical experience, that necessary perspective, then there are people who have never been in a clinic, who've never seen a patient, who just kind of got some data and numbers and said, okay, well, it makes sense to try these 3 medications before you can get this 4th one. That's who's making the decisions for you. So there are things and ways that you have to operate and practice right now while you're doing these peer calls, things like that, because someone else, and oftentimes not even a person who's ever seen a patient, has made that decision for you. For realist, y'all, my idealism is gone. The idealism that I entered into medicine with, it has evaporated. I've had too many personal, professional experiences to kind of continue with things just hoping how I wanted it to be. Now I practice in the way that I know it to be, or I practice in the way that I knew it to be when I was in direct patient care. And now I try to do the best advocacy I can from this end to change a system that is really difficult to be a patient in. I'm a patient in the system, right? I exist in the insurance system as a patient, and also to practice in, because I've done it on both ends too. So that's my answer to the question of how I can work for an insurance company. If my voice isn't there, then someone who's not a physician is going to be there. And I think that the experience that I bring that is valuable, the perspective I bring is valuable. And if there's anything I can do to change it for the better, if my voice can make it better for the person who's still out there actively practicing, then that's what I do. if I can make decisions to make care more accessible to the patients who are in our insurance plan, then that's what I'm going to do. When I see cases where there's just frank fraud, or patients who are being abused, then we have like policies and some things we can do to try to remedy that as well. Now, as to people's perceptions of who I am as a professional, of who I am as a person, based on what my job and my career choice is, I mean, all I can say to that is that, I'm powerless over that. I don't strive to make people like what I do, to make people like me as a person. I don't invite people to care about that, to like it, because that's a lot of energy, right? It's a lot of energy to try to be something other than like who you are. But what I will say is that I try to govern myself and the communication that I'm doing kind of based on this backdrop. And so I guess just to end it, I'll say I hope that, this was helpful.